Well, if I wasn't going to talk about the business plan, I better now, right, since Dr. Patan just put me on the spot. But don't worry, I was planning to anyway. Thank you for that warm and welcome introduction. I do appreciate it, Dr. Patan. And thank you to the Rotary leadership for inviting me here today, especially Cindy Munn for the personal reach out. It is a great opportunity to be here for an organization that has such a rich history and just a wide reach. Thank you, President. I do appreciate the opportunity. So good afternoon, Rotarians. How are you all today? Okay, look, I'm very excited to be here. I know y'all can feel my energy. I talk fast and I have lots of excitement. But it's been a long time since I've been out and about. I've been here for about 2 years back in Louisiana, and this is my second time having an in-person speaking engagement. So we're gonna try it one more time with a little bit better welcome. All right, so good afternoon, Rotarians. All right, see, I know y'all could do better. I know you could. Look, it's really good to see a lot of familiar faces, a lot of familiar organizations. It's nice to be able to have this interaction. It's been a rough 2 years, and so to be able to be here in person really does mean a lot. So I truly do thank you all for the invitation. Before I jump in and try to achieve some of what was asked of me, of one, telling them a little bit about myself personally and my professional journey, and then what's happening at LDH, I do want to take the opportunity to thank you all and your organizations for what you all have done over the past 2 years to assist the department as we've been going through our COVID endeavor. It has been a tough year for everyone, both individually, with their families, and with your organization. So I do appreciate the work that you all have done. To anybody who's in the room that's in any form of public service, thank you all, because you have been in the midst of it, not just for the COVID realm, but also for our hurricanes as well. So thank you for what you do. I've had the opportunity to be on numerous teams that have been responding to the events that have happened and occurred in our state over the last 2 years. And those folks who respond and serve in public service, they do whatever it takes behind the scenes to make it happen so the residents of Louisiana don't have the full impact of those events. Last but not least, I know we have several folks that work into the healthcare system. And it doesn't matter what you do, but if you touch upon healthcare, these last 2 years have truly been a battlefield. And thank you is not enough. It's just not enough for what you all do, what you have done, and the general public will never know what you have done, the long hours you've put in, the sacrifice with your families, your friends, and of yourself, the exhaustion that you are experiencing as you have fought the fight and continue to fight the fight. So as somebody who's in that battle with you, and in many days we wonder, how are we gonna continue? And we figure out a way to dig deep, and we do. I want you all to know that those folks, when you see them, whether it's somebody who works in administrative services, someone who works in communications, someone who works in nutrition services, someone who's on a clinical side, tell them thank you, because they have truly sacrificed for you, and we will never know their sacrifices that they have made so we could be here today. And so again, to all of the workers, thank y'all very much for being in this fight with us. So with that, I'm going to tell you a little bit about myself, and this is never a comfortable thing for me to actually just talk about myself. And Dr. Patan she did a great job introducing me, so I'm like, who is that person? Yeah. So as mentioned, I was born and raised here in Louisiana. I'm from a small town south of New Orleans, Plaquemines Parish, in that is Port Sulphur. So if anybody's been fishing, looking for good seafood, that's the place to go. I will tell you, being born and raised there, you know, hurricanes come to us very frequently, but you don't know as a child in terms of the true impact of a hurricane. And at the time, growing up in Plaquemines Parish, for me, hurricane meant days off for school, a good time, possibly a road trip. But as you become adult, as you get older and you start to truly understand what it means for hurricane season, I will tell you, my hurricane excitement has turned into hurricane anxiety each and every year. And so growing up in that area, it's, you know, good food, good people, and folks who just wrap around you. From there, I attended LSU, as mentioned, and received my undergraduate and graduate degree. And after that, I took on a role at LDH, and I started as a Medicaid intern many years ago, straight out of grad school. And I didn't know what my journey would bring. I initially wanted to be a physical therapist. I knew I wanted to be in the healthcare realm, but God had a different path for me, a path much greater than I had envisioned for myself. And so ended up getting my master's of public administration at LSU and took a role. Guess what my first role was in the healthcare realm? Anybody? This is gonna be interactive, y'all.
Medicaid assistant.
Department of Health. I'm gonna help you out a little bit. You're right, because Medicaid is in the Department of Health. So my first role was Medicaid intern in the Louisiana Department of Health and Hospitals at the time. Many of you remember that before the name was changed to the Louisiana Department of Health, we were the Department of Health and Hospitals. And sometimes, I slip up and I still say Department of Health and Hospitals. Sometimes old habits are, hard to change. And so I started in that role, and I was bit by the bug of public service. I loved it. It was exciting for me. Just the day-to-day policy programming, working with folks, the numerous meetings, problem solving, working with the legislative body. And I found a place that I was very comfortable with. And I worked in several different roles across the Louisiana Department of Health now. As Dr. Patin mentioned, I spent 12 years, and I worked in almost every program. You talk about non-emergency medical transportation, waiver services, working with individuals with developmental disabilities, working in public health programs. You name it, I probably touched upon it. I even served as the resident firefighter. And when I say resident firefighter, I mean, AKA chief of staff, because you just do it all and all the problems come at your desk. But that's what I did. And then I rose up to the realm of serving as the deputy secretary in that department. And then I got a call to go to Nebraska. And I will tell you, I never planned on leaving the state of Louisiana. No way, no how. And I had had several conversations with other states, going to other states. And I knew in my heart that I would never leave Louisiana. And anybody who knew me knew I would never, ever in life leave Louisiana. So much so that when the recruiter reached out to me, he's like, I've been trying to reach you, and he got somebody else to reach out to me. And he said, I already know, they already told me that you're never leaving Louisiana, and it was a waste of my time to call you. And I said, that's what they say about me? And he's like, yes. And I said, well, it's kind of true, it's true. And he's like, just come up and have a conversation with, Governor Ricketts. And it was Governor Pete Ricketts who was sitting at the time in Nebraska, and he's still serving as governor there. And I had the conversation with him, and he shared what he had heard on his campaign trail about the Department of Health in Nebraska. And at that time, I started having an internal conversation that is where I needed to be. That is not where I wanted to be, because I wanted to be here. This was my home. I had grew up in an agency. The Department of Health raised me. I started there as an intern. I was there for 12 years. I knew almost everybody in that department. And here I was thinking in this conversation that I needed to go to Nebraska. I didn't want to go to Nebraska by all means. And sometimes you have a call, but you don't want to answer that call. And even after they offered the job, I still didn't want to answer that call. And after much prayer and conversation, I still didn't want to answer that call. And I knew I needed to, because we're not supposed to not answer those calls when they are from a higher being. And I knew that, but it was still a struggle for me to answer that call and leave everything I knew here. My home, my family. I had one son who was very young, and I had a family at the Department of Health. That was my family, and I truly believed and felt that. But I answered the call because it was a call that was a much greater being than myself. And I ended up going to Nebraska. Keep in mind, I didn't know anybody in Nebraska, not a soul. As a matter of fact, I didn't know anybody in the Midwest. But I packed up my stuff and I answered this call. If the Lord leads you somewhere, he doesn't leave you alone. So I ended up going to Nebraska, to the wonderful state of Nebraska, where they call themselves Nebraska nice, but they also say it's not for everybody. That's the slogan. It's not my slogan, it's Nebraska's slogan. But Nebraska was great. It was a great time working under Governor Ricketts. We had wonderful things that we built in that organization and really shoring up the foundation of that department. And we achieved some really wonderful health outcomes that they still are continuing in the state. I still have those relationships. We still brainstorm in terms of what's happening across state lines and what are some things that we can continue to work towards. Eventually, I got a call in 2018, a big call, Texas-sized call, to go to the state of Texas and work under Governor Greg Abbott. And again, for me, I was like, okay, that's a little bit closer to home. That's what I was thinking. Okay, Nebraska didn't have direct flights to Louisiana, y'all. They didn't have direct flights. So I was like, Texas, that's a little bit closer to home. And so I did. I accepted the role in Texas, and Texas was wonderful. And as they say in Texas, everything is bigger, and so was government. So was the health department. As Dr. Patin mentioned, we had over 60,000 employees, a budget of almost $80 billion in biennial budget. And it was good stuff, and you could achieve really good things. And we had a lot of struggles, foundational struggles. So there's a theme that you see here in terms of the organization and foundational challenge and shoring those up in order to try to move forward with health outcomes. And we did some of that. I didn't spend a lot of time in Texas because I got a call from here in Louisiana. But while I was there, I think we made some great strides. I got a call from the president of the University of Texas System this past week, and the facility that Dr. Paten mentioned is one that they just opened. And so he asked would I be able to come, and unfortunately I wasn't able to. But it's a facility that we had partnered on and broke ground while I was still there. And again, they are going to be the largest psychiatric academic center in the world. And that's really important because we know we struggle as a nation in terms of behavioral health. And we can say we need more services, but if you don't have the individual to provide those services, then we're doing a disservice by just adding services without the individuals to provide those services. And so sometimes you have to build your own, and that's what we started in Texas. And so from there, I got a call from Governor Edwards asking about this particular role in Louisiana, and it was hard for me to leave Texas because we were doing some great things. I was the first female to serve in that role in the Texas Health and Human Services system. And so that was a big feat for me in terms of I have to do a great job because I don't want to be the last person through that door that's a female. And so after only being there a year and a half, I had to make the tough call about coming home. But when you get the opportunity to come back to an entity that raised you, to the department, and also for my son to have the opportunity to have the life and love that I felt in Louisiana, I wanted him to have that experience. And so here I am, back in Louisiana, but I'm gonna tell y'all, I feel like I got a little tricked in Louisiana. And my homecoming was not exactly what I thought it was gonna be. And y'all, don't act like y'all don't know what I'm talking about, because y'all do know. I mean, y'all greeted me with numerous hurricanes, this COVID pandemic. New Orleans was on fire in terms of the cases when I first came in March. And I was like, what is this? And I thought I was leaving everything behind in Nebraska and Texas and coming back home to great crawfish and a good time, wonderful weather. And then you also said, well, we're going to trick her. We got the wonderful winter storm. What was that? I thought I had put my snow boots and my coat and everything up. But y'all tricked me. We had not. And so, look, it has been an interesting 2 years to say the least. It has been a challenge, but I do want y'all to know that y'all have a team at the Louisiana Department of Health that truly is dedicated to serving our state. Even though it has been a challenge over the last 2 years, we are here, we are present, we are tired, but we're not giving up. We are committed to serving our state. And although it has been a challenging 2 years, we know that there are so many things that we can continue to accomplish in our state. And we're talking about COVID. We're in our 5th surge. We have seen the peak, and so as you all are aware, those numbers are going down. We are seeing some improvements. I would just encourage you all, we definitely want folks to be vaccinated. If you're eligible to be boosted. And if you're in an indoor setting or outdoor where you can't distance, to try to mask up right now while we still have so much transmission happening. We're gearing up for Mardi Gras. We all want to have a good time. I just encourage y'all to be safe as we're doing so we can enjoy the success that we're seeing right now as the numbers continue to decrease. And so that is what's consumed us the last 2 years, is recovery and COVID. But that doesn't mean that I wasn't going to push forward of trying to begin a business plan here in our state so we could set the stage. And the reason why I do business plans is I think it's important, regardless of who sits in the lead seat, that the state entity has a plan. And so this plan really is not about me. The plan I left in Texas, and they continue to do it. The plan I left in Nebraska, they continue to do that plan, and they build a plan every year. And the reason why we do these business plans, because it's important to put pen to paper. It's important that the public knows what we're working on, not the 5-year strategic plan, not the 30-year strategic plan. And all of those things are critical, but I know myself personally as a resident of the state, I want to know what you're doing. You're getting my money, so I want to know what you're doing at that department. We have so much work at the Department of Health. There's really not a way to catalog every single thing so the public could really see that. And so the business plan allows us to do a quick snapshot in terms of here are the things we're going to focus on over the next year, but it also focuses and requires us to bring our stakeholders to the table. It can't just be us in the Louisiana Department of Health saying we're going to work to improve this. We have stakeholders across the state that we need to bring to the table, understand where their realms are, what do they see from their perspective. Our folks at Open Health, for example, what does that mean for you all if we put X, Y, Z in place? If we don't have that conversation on the front end, we're missing developing the best policy and program. And so how do we change the culture of our organization to make sure that we are proactive in bringing people to the table? How do we make sure that we outline, here's where we stand as a state, here's where we want to be, now where do we fall at the end of the year in terms of those goals and those outcomes? And it's my job and my team's job to be able to communicate that back to you. If we fall short on one of the goals that we outline, then I need to be able to explain to you why. And we may very well fall short, but I better be able to tell you why. If we decided to change direction, I need to tell you why we changed that direction. Our research may show we need to go in a different realm, a different direction. But we should be able to explain that to you all because you were a part of the process on the front end. And regardless of who's standing and sitting in this seat, standing at this podium, who will be talking for the Department of the Health, they should be able to communicate that with you on an annual basis in terms of here's what's happening at the department. So that's what the hope and the plan is for the business plan going forward. Again, this is the first one. We launched it in November. It runs from July to June. So in June, maybe July, I will be sending out a report saying here's where we wrapped up, here's what we completed, here are our accomplishments, here's where we fall short, and maybe we'll explain that going forward. Right now, I'll tell you in terms of the business plan, it includes 4 different categories in terms of what we're going to focus on. The first one is improving the health and well-being of Louisianians with a focus on prevention. We know we have to do a better job on the front end here in Louisiana in terms of our health care. We continue to ask ourselves, why do we fall last? Why are we only competing with Mississippi? We have to do a better job on the front end in terms of prevention. But the reality is we can't focus on everything at one time. So how do we start to dissect in terms of what are we going to focus on as a state? Not as a Department of Health, but what are we going to focus on when we ask all health systems, all industries to say, here's what we're looking at. We need your help. So I'll give you an example of what's in this category. One of the things we want to focus on is colorectal cancer screenings. Now, that's not the only cancer that we have a problem with here in Louisiana. What if I put all of them there? How are we going to focus on all of them at one time and we'll see that improvement in 1 year? But if I say, okay, I need everybody coming together to focus on this one area, let's see what we could do if we actually put our resources together. Our time, our resource, and our dedication, and let's move the dial on colorectal cancer screening. Then next year we come together and say, okay, all right, look at this. Coming together, we were able to achieve something. What are we going to do next year? And that's what you'll see in this plan. You also see some work around our maternal health. We know we have some work to do there. We want to increase breastfeeding rates. We want to decrease the number of maternal deaths that we experience in our state. So there's numerous initiatives and goals that you'll see outlined in this plan. Another area will be around behavioral health services. Dr. Patan talked about the work I did in Nebraska and Texas as it relates to behavioral health. And we have just as much work here in Louisiana to do. Part of what you'll see we're building out this year in our department and working with stakeholders is building that continuum crisis of care, making sure that we have access to services when someone is in crisis. And so we're looking at expanding services as it relates to mobile crisis services, and not just in a particular area in our state, but how do we make sure we have geographic locations that folks can have access to mobile crisis services. Then also, what does it look like if we add behavioral health urgent care centers in our state? Again, looking at a regional structure. We all have urgent care areas in our neighborhoods for physical and primary health, but you don't see any for behavioral health because they don't exist today. But that should be a part of our continuum of care. The hospital should not be the only place that folks can get behavioral health services. We shouldn't have lower level and high acute. We need that in between, and that's something we have to build in our state. So that's another piece that you'll see in the business plan as it relates to that. And I'll jump to the next one. The second one is reshaping our LDH culture. And some folks have asked me, why in the public business plan are you talking about LDH culture and internal stuff? And for me, it's really important. You all work in the business community. You know, if you don't have a strong foundation with your employees and your organization, it doesn't matter what you put as your goals and your outcomes, you're not going to achieve them. You're going to continue to backslide. So when folks tell me, hey, we want to move from number 40 or something to number 10, I'm like, that's great. But if I don't have the employees to make it happen, we might move, backslide. It does no good. And so you all know in the private sector that it's important to have recruitment, retention, succession planning efforts. We don't have a true succession planning program at the Louisiana Department of Health. That's problematic. For many of you who may even interact with the department, if you've worked with somebody who's in a program for 20 to 30 years and they retire and I don't have anybody who's going to take their place, not because I can't find a great employee who's dedicated, who has personal work ethic, but I'm asking that person to catch up 30 years of knowledge. It's impossible. I'm doing you a disservice in terms of who you can connect with and how do we continue to provide that continuum of service in the department. We're going to forever play catch up if we don't have these basic fundamentals in place in terms of our foundation at LDH. The other thing is when I look at our time to hire, employment is tough right now. Everybody's searching for employees. It takes us months from the time I request to hire to post to get somebody in the door. Well, guess what? I lost them to y'all. I don't want to lose them to y'all. Y'all are great, but I need them myself. And so how do we put some process improvements in place from that time that I request to fill the position to the person is sitting in the door ready to go through orientation and training? Those are basic things that you all are looking at in y'all's organization that we have to look at in government. We have to do that if we want to be able to provide the best services on the back end. So those are some of the things you'll see around our team LDH and our culture. The third component of our business plan is enhancing customer service, partnerships, and community relations. And this is really important to me because I am a firm believer if you do not have those relationships and bring folks to the table, you miss the opportunity to produce the best policy in the program. Again, I feel like I could write great policy in my office all day. I think it's the best policy in my office, in my four walls. But the minute I hand it to anybody else, it's not going to be the best policy. You're going to see something that I miss because you wear a different lens than I wear. And we have to be more open in the department of bringing people to the table who have a different perspective, folks who are at the point of service, folks who are on the ground making those decisions and implementing the services, on the front end versus the back end saying, hey, we pushed this policy and program forward at LDH. Let us know if you have any problems. Well, it's too late. We're asking you to implement it without doing those trial and those conversations on the front end. And so that's an important piece. The other piece we want to do there, one thing I did in a couple of other states, is we did lots of partnerships with universities. The feds allow you to do partnerships with the universities when they already have some available dollars if you're working on the same projects and draw down federal dollars. We have a lot of opportunity to do this here in Louisiana of partnering with our public universities and increasing the dollars we're drawing down from the federal government as it relates to shared projects and interests. And so that's another piece of the work that we want to do in our state. The last component of our business plan is promoting transparency, accountability, and compliance. And I talked about this a little bit earlier in terms of part of why we're doing the business plan, because we should be accountable to the public. We should be transparent in terms of what we're working on. How do we make sure we stay in compliance with federal regulations? So under this particular area, you'll see things where we're looking at building in some of our work around predictive analytics to make sure we're increasing the amount of cases on the Medicaid side that we're looking at in terms of fraud, waste, and abuse, both on the provider and the recipient side, not just some of the old algorithms that we've been using. And so we have some clear quantitative metrics in there in terms of most of these goals of what we have to reach by the end of the fiscal year, which wraps up in June. And so I would urge you, if you haven't read this wonderful document, to take your time and do look through it and read it. I will make sure I send the electronic version to the Rotary so you all have it. I would love to come back and to share our results with you all when we close out our business plan. But again, the business plan is not about me, it's about our state and our agency. I love Louisiana, I love the Department of Health, and I really want us to do the best that we could for everyone in our state. I plan on being here, I plan on raising my son here, and so I want us to be in the best shape possible going forward here in our state. So again, I just appreciate the opportunity to be here, the opportunity to be in person to speak with you all, and to share a little bit about myself, the person who serves as the secretary for your Department of Health, as well as what we're doing in terms of the Louisiana Department of Health. So thank y'all for the opportunity. And I think we have time for a couple of questions.
Could you talk about your philosophy on all these different health issues? What should the state really be driving, or what should the Oshners, Lady to Lake, the hospital system people be driving?
I think, and part of that is the partnership piece that I'm talking about. So we'll use the example that I talked about with colorectal cancer screening. So the state could do a strategy. We have the Office of Public Health who touches across numerous entities, our public health units. We have specific grants from the Centers for Disease Control. But we also have those health systems. We have our hospitals. We have different physician groups. We have our FQHCs, our rural hospital clinics, our rural health clinics. All of those we need coming to the table to actually achieve the goal. So we can say the colorectal cancer screening increase is our goal, but unless we get those partners involved and lined up to say, you know what, it's a priority for us too. It's a priority, should it be a priority for our health insurance companies? We need all of the entities who play into the health system space to say, okay, this year, we're behind you, we're gonna focus on this goal and we're gonna move the dial. If we all have different priorities, then what does that do? We're splitting our resource and our time, and we're never gonna move the dial together on what we need to focus on in Louisiana. So you're absolutely right in terms of, do we need those systems coming to the table? Yes. Our job as a convener bringing together, setting that policy, looking at what are the policies and programs needed to move forward to help make that change, and who the appropriate partners that we need to call to the table to say, we need your help in actually achieving this and making this happen.
And what leverage do you have with those partners?
So some of those partners play into the Medicaid space, where they are providers within the Medicaid program, which is our public insurance. Others have contracts with our Office of Public Health. And the other leverage, I need you to be a good partner. You're part of the healthcare space. You have an onus and a mission to serve our residents just as I do. And so making sure that we come together and have those conversations on the front end. And I don't think you always need a stick. I think if you invite people to the table on the front end and say, here's what we're trying to do, how do we align what you are working on? How do we align where we want to go? And how do we bring that together? And that's what we did on the example that I just provided. Oh, let's see. Let's go right here.
Two really quick questions.
Sure.
How's the critical access hospital landscape in Louisiana? Do we have enough? We don't have enough?
So I'll say right now in terms of, I have not done an assessment in terms of do we have enough. I will say on the hospital front in general, including critical access hospitals, it's a struggle right now in our healthcare industry because of access to workers. We are struggling completely. The federal government allowed us recently, or for the last several months, we have been providing nursing services via contract. And we kept our contracts going because we knew we would probably have up and down a surge as it relates to COVID. Thankfully so, because I think that's why we were in the position that we have been to be able to maintain the number of beds and the bed capacity in our state across the board between the different tier levels of the hospitals, including critical access. But it is a struggle for our hospitals to be able to maintain that bed capacity, given the current nursing shortage.
And then the second one is the university initiative. The internships with the universities, you're saying their students in certain disciplines might volunteer or do internships with.
Yeah, I'll explain a little bit further. We do have an internship component in the business plan. That's not exactly what I was alluding to, but I'm glad you mentioned that because we do, so you'll get more about that. But this one is really looking at, say for instance, and I'll use an example for Pennington, and I'm just throwing out an example. If they have a particular research project that they're looking at, that also aligns with research that the Louisiana Department of Health wants to do. If they already have state funding for that research, we're able to partner with them and enter into a joint relationship to draw down some federal funding to be able to expand that research. So it increases the dollars available to our state if we're entering into joint programs that the federal government would support. Thank you, sir.
Me?
Yes, ma'am. And then I'll get you next, sir.
My question is a little off the wall. It's probably because.
Oh man, let me drink a little water if it's off.
So we see Our Lady of the Lake and Marybrook Perkins is split, and then Our Lady of the Lake is buying up a lot of different groups, and then Marybrook Perkins is siding with different people. And what does this all mean to us as an individual? All this chaos.
I do think, and that question is not for me, it's for Marybrook Perkins and Our Lady of the Lake, but I'll touch upon it a little bit. You do see changes in the healthcare landscape in terms of systems diversifying. I don't think that that's a bad thing, because what you don't want is, I don't want the only service I get is to be at a higher level of service. If I could avoid hospital level care, I want to. And so when a healthcare system is diversifying and building on that continuum from prevention services, so your primary care doc, urgent care, and the different levels in that continuum of care, I do think that is a better process versus just that higher level of care. Because I don't want somebody to just wait to treat me until I no longer can qualify or need those services and I'm at that higher level of care. Now, in terms of that particular situation, I really don't know what happened or why. At the end of the day, for me, I need all of them at the table because I need all of them to make this happen. It doesn't matter to me who partners with who, because I still need you at the table to do what we need to do for the residents of the state. Thank you, ma'am.
Well, first I wanted to just thank you and commend you for recognizing the importance of the United Way 211 service. It was deployed during the pandemic, and just in our region alone, we had over 40,000 calls from just community members and residents seeking information that was provided by you guys. So I thought it was a good use of information to deploy, good use of that service to deploy information.
Is that y'all's table back there, United Way?
Yeah.
Look, and I didn't call them out specifically, but they are part of the healthcare system. Y'all were phenomenal. Each time I called or sent a team member to call you all to say, can you do this also? What about this? Y'all did. We pushed out information, you fielded calls with detailed information to our residents. We had so many calls coming through during hurricane season that 211 in Florida, in Texas also helped out for that overflow. We truly appreciated what you all did during hurricane and COVID. We could not have been able to field those calls at the department, and even with our call centers, had you all not been an easy source of information for our state. Everyone knows y'all, they know the number, and to be able to have that information when folks could call to say, hey, I have a question about testing, where can I go? I have a question about vaccine, where can I go? You all were able to field that and decipher very quickly for our residents, so I truly appreciate y'all. Thank you. Yes, ma'am.
With your take on the higher level services, how are you going to address the backlog of waiver services for up to 10,000 people who are waiting up to 7 years to be put on the waiver system?
And so on the waiver services, I think we're talking about aging services and individuals with developmental disabilities. So for individuals with developmental disabilities, we don't have a waiting list anymore in this great state. The state has done a phenomenal job of eliminating that wait list. It was not easy because, as you just said, we had tens of thousands of families waiting on the wait list for years for services. The same work we did with the developmental disabilities, we have to do on the aging side. That's just the work we have to put in terms of increasing the number of waiver services. As we are able to decrease the cap of cost by adding services and that variability, we will be able to add more people to those waiver services. That's just the work that we're gonna have to do. The other piece of that I'm gonna mention that we have to be very mindful of, because it's not just adding additional capacity. If you don't have folks to provide those services, it doesn't matter how many waiver available slots that we have if you don't have those direct service workers. So one thing you'll see in our budget this session is to increase the wages for direct service workers, both on the aging population, both for individuals who are serving individuals in the developmental population, as well as some of our forensic transition. Because we do know that those entities are struggling for workers. And that's our most vulnerable population here in our state. And we have to make sure that they have a wage that they continue to provide those services. So that is the first piece. You won't see in the budget a necessary increase in those waiver services yet, because I really did feel like we have to stabilize that workforce to maintain the individuals we're currently serving. But next year, and maybe internally, we're gonna be able to do some things. So if you're interested in that, I would love to have further conversation with you on that. Thank you. Yes, ma'am.
One more.
Oh,
One more.
it's one more, sorry.
You mentioned the expansion kind of to mental health services. Can you talk a little bit, I guess, about like budget that's being allocated to that? Or should we see regional facilities opening up soon? Or are there other steps that we would see before that that would give us some indication that there's movement taking place to support the mental health services?
Yeah, I'm gonna be back in June to tell you what we did, of course. So what we're planning, I mentioned mobile crisis services. Our goal, we recently put a RFI, request for information, out for entities to bid for one in each region in our state. So our LDH regions, for behavioral health, we divide into 10 regions. And so we're looking for a mobile crisis company, entity to provide those services in each region. And then we're also looking at having a behavioral health urgent care center in each one of those regions. We are in the process of those scoring and contracts right now. Last year, we put in a budget request with our legislative body for those services, and it did get funded. We had the opportunity to apply for the feds for some enhanced federal funding, and we are in the process of going back and forth with our feds, asking questions, us providing answers, to see if we can get some enhanced federal match to support some of those services as well. So I do think over the next year, you will see some movement on those two services.
Thank you.